Assalamu alaikum, the communication day. First scenario, you are the doctor in the general medical ward. Mr. John, 35 years old, presented with complaint of fever, headache, and jaundice. After series of blood tests, the hepatitis B confirmed. Please sit with him, explain the disease, address his concerns.
Hello, I am Dr. Muhammad. I am one of the doctor here today. I need to confirm Mr. John, 30 years old with me?
Yes, doctor.
Yes, Mr. John. We are here today to discuss some health issue for you and address your concern, if you don't mind. It's okay for you?
Sure, doctor.
Do you want anyone to be with us to be supporting you?
No, doctor.
Okay. Firstly, I need to know how much do you know about your condition until now?
Doctor, recently I bothered with high body temperatures and headache, and my eye turned yellow. So I came here for the hospital, and they did for me a lot of blood tests. Now I came here to know the result of this blood test.
I appreciate your knowledge, Mr. John. And I need to know what's your expectation from this result today.
Just doctor, I need to know what is the problem with me. What is the disease with me?
Yes, okay, Mr. John. The result, as you mentioned, you have did this lab and this workup, and this result with me, and I am sorry to tell you, there is something concerning there.
What was the result, doctor? Please tell me.
There is the result showing, Mr. John, there is some bug infection, and it is serious bug infection called hepatitis B virus. Do you know anything about this?
No, doctor, please explain for me what is this disease.
Okay, Mr. John, I am here to explain for you and to do our best for you. This hepatitis B virus, it is a bug that go through bloodstream, reaching the liver, affecting the liver, causing some soreness, and by the time may affect its function, may cause it to be shrunken, and sometimes cause it to be failure from working. That's why you started to have this yellow eye and this fever. Are you with me, Mr. John?
Yes, doctor. It seemed to be a serious disease, right?
I am so sorry for that, Mr. John. It is serious, but at the same time, we can control it by giving some recent medication, and we can control it by following up and doing serial following up with the clinic, and our liver doctor will be here to support this. Are you with me, Mr. John?
Yes, with you, doctor. But please tell me more what this virus can cause for me, and what is complication I can expect from such a serious infection.
Okay, Mr. John. Firstly, Mr. John, I need to inform you some information about this bug. How is it transferred to any people? Because it is transferable and can be transmitted from one to one through blood transfusion, through any procedure, any operations, sometimes through unsafe intimate relationship, and sometimes from can be from the birth and become active later on. That's this is how it is come to the person and infected by it. Are you with me, Mr. John?
Yes, with you, doctor.
Regarding the what is this bug affecting our health, it is by the time it can be active. Sometimes it become not active, but as long as it is active and can be controlled, by the time it can affect our liver, causing more soreness, causing to be shrunken, and affecting its function. That's maybe lead to affecting the conscious level sometime, causing sometimes throwing blood from our gut or lower gut. Sometime, I'm so sorry to tell this, may reach to be have to change it to be like overgrowth of cancers. Are you with me, Mr. John?
Yes, with you, doctor. Proceed.
I know it is hard information today and hard news for you, chockable for you, but we are here today to support and to start our treatment and management to decrease the chance of this complication. It's okay.
Okay, doctor. So this disease, is it curable, doctor? I can get out from this disease?
I'm so sorry. I appreciate your knowledge, Mr. John, but until now, no available treatment for it. But we have a recent medication available that can control it and decrease the chance of this complication by following up with the clinic and the liver doctor. And there is some small percentage of the patients they can be negative or change it the bug to be like not active and like cured by itself, but it is small percent of the patients.
Okay, doctor. So this treatment, for how long I will take it?
Okay, Mr. Jude, I appreciate your knowledge. It will be with the following up with the liver doctor and by serial tracing how much it is active and how much the level of this bug in the blood. You will take the medication. Some patient can take for months, some patient for years until we confirm that it is not active. Then we will follow it serial by on serial basis until we confirm that it is not active. So it is a long-term follow-up for this bug.
Okay, doctor.
I need to inform you some precaution, Mr. John, because as I mentioned before, this bug can be transmitted from person to person. Do you have a partner, Mr. John?
I'm married, doctor.
Okay, Mr. John. I strongly advise to inform your wife and to start also to do some workup for her to confirm this bug it is infected also by it or not. And as I mentioned, it can be transmitted by through sharing needles, through sharing anything affecting the blood or cutting the skin. So we need to trace the family about that to early detect it and manage it early. Is it okay for you?
So you will trace my family member, doctor?
2 minutes left.
As I appreciate your knowledge, Mr. John, but as I mentioned, anyone contacted through any blood, any skin cutting or intimate relationship, better to be traced.
Okay, doctor.
And for this time, Mr. John, I advise you strongly to be protective intimate relationship and avoid any sharing any hard, any sharp needles or any blood transfusion to decrease the infection to other people for this and to protect the other. It's okay for you, Mr. John?
Okay, doctor. I will avoid blood transfusion.
Okay, Mr. John, do you smoke?
Yes, doctor.
I advise you to stop it because it will be very harmful for your liver and will help us for that, for managing it, okay?
Okay.
Any alcohol intake?
Yes, doctor.
Also, Mr. John, strongly advise you, we can help you by our clinics here to cut it down because it will be very harmful for liver also, and it will help us to manage it as early as possible. Okay?
Okay, doctor.
Okay, Mr. John. For now, what you are doing for living?
I am teacher, doctor.
Okay. We also we will give some report for you regarding this, and any support in the job we are here to help. And I will give you some brochure and some leaflets, some website to read more about this bug. And our hospital number will be with you for any advice or any help for this issue. It's okay.
Okay, doctor.
Other concern?
Uh, Thank you, doctor.
Thank you, Mr. John. Thank you.
Okay, time is up. You can comment now, Dr. Khalid.
Well done, Dr. Muhammad. Although I expected for you to explain more about you touched the complication of hepatitis and liver cirrhosis. You mentioned bleeding and encephalopathy. It is better if you mention also ascites tummy distension and putting you at a risk of getting infection easily. I think also tracing of family member. If I think it is better if you said we will test your wife. I think that. Otherwise, overall, you address the concern, the clinical judgment, communication skills. Good. I think just these 2 points. Also, we wait Dr. Basim to comment on it about the wife, to test the wife for hepatitis B and further evaporation about the complication of hepatitis and even liver cirrhosis. Regarding the concern of how long this treatment, you address it well. We will refer you to liver doctor. This few percentage of the person may be curable, yes. That is all. Overall, well done, Dr. Muhammad. Thank you.
Thank you.
Bid one, family. Okay, thank you, Dr. Khalid, for the case and the comment. I agree regarding most of the concerns, but I usually and always advise to give more informations and instruction about the complication of the disease. They are focusing on this.
Yes.
What complication will happen here? The cirrhosis. You mentioned the scarring of the liver, Dr. Muhammad.
Scarring, encephalopathy, bleeding. I forget only it was in my paper. يعني the tummy distension, maybe
Yeah,
in
yeah.
your about.
So they like this, this idea to explain the complication. What will happen? Why? Because you are using this to convince the patient we don't need this to happen, and don't worry, we'll be side by side along with this journey with you. We will help and support you. We'll give you the medication to help not to have this complication. I prefer not to invite someone, not only in hepatitis B, in all infectious disease. You cannot invite someone. It's something embarrassing to know from where he might ask you, doctor, from where I get this infection. Maybe he will have sexual contact.
Waited this question, Dr. Basim did.
Yes. Yes.
Sorry?
I waited
هي
this.
Yeah, okay.
I
أنا
waited
So,
this
أنا
from
هحاول
him, but I
أنا
offer it after not informed. I offer it later on.
yeah,
yes
it's
yes
not recommended. So not only in this HIV, hepatitis B, hepatitis C, any infectious disease, it's not accepted to ask about or invite someone. He will tell you, doctor, I don't want anyone to know about my result. What if you said that in front of someone else? It will be very embarrassing, and it might create a problem with him. For example, he might ask you, doctor, from where I got this infection. Then you can enumerate the causes. Sometimes with sharing needles, sometimes with sex or unprotected sex, with someone infected with this, or receiving blood. Sometimes also with procedure like dental procedure. If he asks, and by the way, this is one of the concerns in hepatitis scenarios. Okay, so be ready to answer it, but don't ask it. Don't ask how or how you get this, or did you have any history of contact with someone sick, or you have contact with sharing needles, or don't ask the question. Just Give him the examples, and he will tell you, yes, doctor, I had that previously. Maybe this one, yes. You can say, yes, this is the one. The long-term medication, as you said, you can give him the idea there is medication. It can be for long term. However, it will not kill the virus. It can control it. Other complication, by the way, the cancer, hepatocellular carcinoma. So it might turn to a cancer, right? I think you mentioned.
Mentioned.
Yes, okay. So the cancer, cirrhosis, ascites, failure, liver failure in the form of ascites, being confused, not awake, having bleeding, bleeding tendency everywhere, distension of the tummy, all this you have to mention. Usually the patient need to hear the complication to be convinced. I have to be compliant to the medication. Okay. The contact, yes, you have to not only to contact trace, you have to inform him he has to have safe sex with his partner and along with the screening. Not only here, even in the HIV and other. Don't donate blood as you did exactly. Use your private tools. Don't share your tools with anyone. Also, whenever you have any surgery, inform your GP or your doctor that you have this. For the alcohol, yes, it's not advisable, or you can say don't take alcohol at all. Any amount will lead to more shrink of the liver or scarring of the liver. The job itself you can address. If he has any impact on his job, you can ask him, or you can give him sick leave until he will be fine. This is regarding the all skills. I think you fulfill most of the skills, but I want to change. Appreciate your knowledge. Make another sentence. Usually, you are saying it. You can say it's a valid point. It's a valid concern. I appreciate your feeling. I can see how much you are worried. Okay, try to post another sentence. Not only I appreciate your knowledge. Okay.
Okay.
In general, yes, it was good, Dr. Muhammad. Is it curable? No, I don't think it's curable. Let's go to a comment. Sorry, your scenario, Dr. Khalid. I will post your scenario in the chat box. Then I will go to the comments. Sorry. Here you go, the scenario in the chat box, Dr. Khalid.
Okay.
Your role, you are the doctor in the endocrine clinic. Patient Mrs. Catherine, 30 years old, presented with palpitation, tremors, and terror, neck swelling, and blurring of vision 2 years ago. She was diagnosed with Graves' disease, was started on carbimazole tablet, 40 milligram once daily for 18 months. Trial of weaning of carbimazole leads to recurrence of hyperthyroidism symptoms. Her GP had restarted carbimazole and she was referred to endocrine clinic for further management. Her latest thyroid function test, TSH.6, normal from zero point 0.5 to 5, pre-T4 18, within normal 11 to 12, 22. Your consultant has decided that she should go for radioactive iodine therapy. Your task to counsel and explain the patient regarding the procedure and answer the questions. Take your time, Dr. Khalid. We'll be back to you. Okay, let's start with first, yeah, Dr. Omar. Why he had such hepatitis B? History of blood transfusion, risky behavior, tattooing, job, stop sexual relationship till further advice, identify partner, need to be tested. This is sensitive scenario, no need to involve other. Exactly, this is what we mentioned. Yes, regarding stop sexual relation, you cannot say to him stop sexual relation. You have to say, or you can say, use or practice safe sex. You cannot stop his sexual relation, right?
Uh,
So at least, yes, yes, Doctor.
I'm sorry. How are Dr.
I'm
Bassem?
fine. I'm fine.
How's everyone?
Oh,
I think it's if it's unclear from the scenario is the patient does have because didn't provide. Usually in the exam they will throw a bunch of investigations for you to waste your time. But it depends if the patient is infective and he can stop. And this is myself why I was advised when I had a stick needle and I went to the occupational health. They give me a stop advice in the clinic to stop until your next test. This was what I was advised on reality, to be honest. So
Totally stop or
totally stop. Yeah, till the next test to test the titr or the level.
okay.
So if it is vague, then you are signpost the patient anyway to the STI clinic, or because he wouldn't be following up just with you, he would be with an MDT. Amongst them, the STI, they would give him advice about sexual relation. This is what I know. You can correct me.
Okay. What about the duration? For how long it will be the result?
Usually, you will be having a follow up. It depends on which phase you are in. If you on the antibody phases, if you are in which window, there's a test that's been done. So if it's unclear, you can. I don't think it would be harmful if you advised to stop sexual relationship
It's
at the time
it's
being.
not harmful, but for how long? Maybe for days. Okay, it will be accepted.
Yeah,
Does make sense. But if for months, for example, like to repeat the next reading for HIV, maybe it takes months. So you'll be stopped. I don't think so. Anyway, you
because the
mentioned your
partner is not tested also, so it's until
yes,
the
yes,
partner at least reviewed,
yeah,
and
yes.
yeah, we can, yeah.
Yeah, it makes sense to test the partner until, and not only that, by the way, they are not testing only for hepatitis B. Sometimes they are screening for hepatitis C and HIV, particularly for the healthcare provider. This is the
Yeah.
question, next question by Dr. Dina. What if the patient got hepatitis B? Yeah, this is the point. If hepatitis B for healthcare provider, so they can do the all labs, including the antibodies, the antigen, and they are checking if he needs to be re, given vaccine or just to check the immunity for him if he's immunized. No need. Sometimes they are giving the immunoglobulin. So it depends on his antibodies. Okay, this is for Dr. Dina question. Only the healthcare provider. Okay, but if someone else, they yes they can do the screening, but here, as the scenario said, it's already infection, so he will start on the anti-hepatitis. Okay, for the curable, no, it's not curable. They are trying to control the infection or the virus. What else as a question? Usually, Dr. Omar, usually to her GP, if you are in the clinic, sexually transmitted in the clinic, she can be booked directly to the clinic. Yeah, this is occupational, you mean, staff clinic.
Oh no, no. I thought that the question was about the wife, the if his wife, if it's about the partner. But I didn't read that it's for the. I didn't get that it's for
Ah,
doctor or
okay.
nurse. Yeah.
Yeah, yeah, this is the point. If Dr. Arnes, it will be different scenario. Dr. Dina, there is also session about that. The doctor will not be having or doing or practicing his job. If surgeon, for example, he will be prohibited to practice the surgery until he will be cleared or his viral load will be controlled. There is a session about that previously. We have discussed it. So it's totally different. The patient, or sorry, the doctor or the nurse would be reallocated, and they will not be handling patient or doing surgery to a patient in order not to spread the infection to others. Okay, so it's totally different scenario.
Uh, Salam.
Sorry.
Dr.
Yes.
Basim, I want to
Yes.
comment on this.
Okay. Continue.
Okay. I mean, if I read the scenario, so the scenario, I'm talking about the first scenario. Mr. John, 35 years old, complaining of fever, headache, and jaundice after series of blood tests. Hepatitis B confirmed. Sit with him, explain the disease, and address his concern. So, my understanding is that symptoms he's having, they haven't mentioned whether these are acute symptoms or chronic symptoms. They haven't mentioned that whether the patient have developed cirrhosis or not. I mean, it seemed that when Dr. Muhammad was taking the details of the problem, that it is the first time patient being diagnosed with hepatitis B, Generally, if anyone develop or being diagnosed with hepatitis B for the first time, I mean, if it is the first diagnosis, we wait for 6 months, repeat the hepatitis B profile. 85 to 90% of the patient who do get hepatitis B infection, they do self clear the virus within 6 months' time. Only if the virus persists after 6 months, then we think in terms of a chronic hepatitis B. So hepatitis B infection in itself, it is something that the clearance rate by your natural immunity, it is around 85 to 90%. So to say this patient that I'm going to start you on treatment, I think it is little bit, I mean, this is the my understanding, correct me if I'm wrong, that this patient at the moment, if he has a first time diagnosis of hep B, so you cannot straight away say to the patient that I'm going to start, because the clearance rate for hepatitis B is around 85 to 90% in 6 months' time. Only if the problem persists after 6 months, then you will document that it is a chronic hepatitis B infection and this one requires treatment. So this is one. So my understanding is that in this scenario, if it is the first time, so I will take it as an acute hepatitis B infection and will give time of at least 6 months and then see whether the patient have a persistent viral replication and then consider treatment. This is one. The other thing is that I think that Dr. Muhammad haven't mentioned anything or didn't ask about, obviously might not be relevant for the patient, but pretty much relevant for the family. He didn't ask about the hepatitis B vaccine. So, whether the family members have been vaccinated or not. So, are you going to vaccinate? So, that's another thing which you need to tell the patient, that we need to test your wife and have your kids being checked as well. And if they are all negative, the first thing we're going to do is that we'll encourage you to have them vaccinated. Okay. And regarding this patient, I think that again, the same point, the emphasis should be that we need to wait at least 6 months to see whether the patient have a persistent viral replication. To say right away that we are going to start you on treatment for Hep B, it is not right. Yes, if it would have been hepatitis C, you know that hepatitis B, in that case, the chances of a chronic infection whenever it is being picked up, so it's almost 99% likely to have a chronic infection, because Hep C is not cleared by our own immune system. But for Hep B, it is not that. So as I told, around 85 to 90% of the patient, they do clear the virus on their own, and you need to wait for 6 months before making any decision about the treatment. So I think it was, to me, I think this is my understanding of the scenario. It was just to explain these things and then tell the patient that this is a natural kind of a course of the virus, and only if it persists after 6 months and your body is unable to clear the virus on its own, then we'll consider starting your treatment. So I mean, this is my comment on this scenario.
Yeah,
Thank you.
okay. Thank you, Dr. Hacham. As you mentioned, and as usually mentioned, sometimes the scenarios are concise. It's not that much detail, but in exam it will be detailed. Here they didn't mention to start or not, just to explain about the result. So you don't know even if it's infection or just the screening. But I go with this patient is having active hepatitis B and need to counsel about the disease. Is it controllable or no? Is it something to be transmitted or no? How to address the other lifestyle modification, alcohol, and so on. So it's like counseling about a disease, not in details.
Can
So
I
what
comment?
Dr. Muhammad did, yes, I will
Can I
just finish
comment?
this comment, then you can comment.
Yeah.
What Dr. Muhammad did, I think it's concised to the point. No need to go through the other to be carrier or to be
Yeah.
even you don't know. And the best thing here to refer the patient to the liver
Right.
doctor. He will be following and he will tell you about the result, about the follow up, the screening, and the other things. As I think Dr. Muhammad did it in proper way. In
Yes,
exam,
yes.
yes, they will tell you if you want to talk about tenofovir medication or the active state or acute state or chronic form, complicated or no. Here, just to be as idea about the hepatitis B. Okay, so don't expect that you will talk a lot. Just be touching the important point. This is the communication skills, not knowledge examination. Yes, Dr. Muhammad, you can comment. Then we'll start with Dr. Khalid after these comments.
Yes, Dr. Bassem, طبعا Dr. Hisham, I think. As you mentioned, Dr. Bassem, we didn't tell to the patient firstly, and we didn't tell to the patient we'll start the treatment. We told him we will refer you to we'll see our liver doctor, and he will see if we will start the treatment or like this. And we didn't take the decision to start the treatment. And by this way, if we take it as it is like this, and I will tell him, Allah, you have 6 months, you are assuring the patient. And this way, why you will tell him about the complication, you will be about the precautions, about everything. I don't think so. The case communication will come by this way that you will give him, Allah, it's 6 months, it is can be cured or can be يعني cleared from your body. Can be if the scenario mentioned to you that it is acute state and still have another test or يعني he should give some hint in the scenario to not go deep to the patient. But as it is infectious disease and it is a serious bug, it is not يعني like influenza or something. No, and the patient is sick, and maybe this acute state even may be dangerous for him. Even the acute state, it may be dangerous, and maybe go to fulminant failure. And maybe I should mention it during the scenario. Maybe go to the fulminant failure, and maybe have all the complication except the cancer on these 6 months. So I don't think so. It will be like this to tell him 6 months and we will let another test. No, he should know everything about the disease from the precaution and the complication and everything to be ready, whatever cleared or not. And you have fee some percentage. Maybe I need to change. So I will tell some percentage of the patient can be cured from itself by the immunity of the patient, but we will follow you thoroughly and we will see in the liver clinic what will be happening, and we will follow you and we will be supporting you. I think
Yes.
like that, Dr. Bassem.
Yeah. It's just as the level of the details in the scenario. If it's detailed, you can go with the detailed. If just idea, so you will do superficial about the topic itself, the idea, how to manage, how to address the concerns, the lifestyle modification. But be sure, if they mention more details, you have to deliver the details, as Dr. Hisham mentioned, the status or the chronicity or whatever. But they are not testing the knowledge. If they are not mentioning, don't explain by yourself. Okay, Dr. Hisham, this is my point. But you're right. Sometimes they give you the detailed scenario. That time you can explain more and more. Since you are the medical doctor, no need to explain about the details of the viral and infectious disease job or task. This is not your task here in this scenario. And again, in communication, they are testing the knowledge in one skill only, clinical judgment. Otherwise, they are saying how you are maintaining the concerns, maintaining the welfare, and how to do the clinical communication. Three skills out of the knowledge, only one for the knowledge, and you can pass the station even if you said something wrong, but don't be fatal mistake. Don't do fatal mistake. Okay, don't
I
say
need to
something
mention
can.
I need to
Okay.
mention some experience, Dr. Bassem, regarding the details. Our my exam, I told about hepatitis C, and you know it, Dr. Bassem, hepatitis C and B, I think, especially hepatitis C, I think.
Yes.
I add only some detail about the new medication. I mentioned sofosbuvir, dactalavir, like this. For 1 minute, some details about it. The feedback came to me like this: the doctor giving his views to the patient and didn't hear to him or something like this. But he mentioned like this: the candidate give his views to the patient. تمام؟ يعني كأني as I giving him from my side some new information or something away from the scenario. So take care from any word away from the scenario, any new medication, any information. He will leave all your success in the case, and he will
Yes.
mention that wrong
I agree.
information, more
Uh,
detailed views from the candidate. he will mention like this, and he will submit many marks from you.
Yes, yes, you're right. Okay, you got it, Dr. Hisham. We are not against your point. Yes, as knowledge, you're right. But in the clinical communication or as a communication task or a scenario, they don't need that much details. However, if the scenario was detailed one, do according to the level of the scenario. I hope it's clear now, Dr. Hisham.
Yes, yes, it's clear. But
Uh,
I mean, obviously, I just wanted to clarify this point because it,
yes,
yeah,
yes, you're
I
right.
agree
I
that
said
it
you're
was,
right. Knowledge,
yeah, it
knowledge
was
wise.
unclear from the scenario, and I mean, that's why I agree that we need to explain that these are the things which can happen, but
Mhm.
you need to tell the patient some positive things as well, that there is a possibility, and this is something which is high actually in hepatitis B. So, I mean, my point is that we need to give that positive side of the things to the patient as well, rather than saying that the patient is
If
will
you
be
know
healthy.
this level of the immunity or the level of antibodies, you can talk about it. But usually, by default, most of them will be chronic. So the chronicity is I think this is the most common one. I don't know if how much percentage, but I think this is
Dr.
the most.
Basim, no, no, from chronicity point of view,
Yeah.
hepatitis C is the one which is the most chronic. So if
Okay.
someone having a hepatitis C, then there is a 95 to 99% chances that the patient will develop chronic. So Hep C is the most chronic. Regarding
Okay.
Hep B, the natural history of the disease is that if someone get an hepatitis B virus infection,
Hmm.
like an acute infection, so 85 to 95% patient they do clear the virus on their own within 6 months. So you
Hmm.
just need to wait for 6 months. So initially, you might find that the HPV DNA and all these things they may be very high, but around 85 to 95% they do clear the virus on their own. Among the remaining 10% the patient, around 2 to 3%, I mean generally that is less than 5%, that these patients develop into, around 2% develop the chronic I mean the cirrhosis, and the rest of them they go into a chronic hepatitis or chronic active hepatitis. So the chances of self clearance by the body for hep B, it is very very high. So this is something which is
Yeah.
in
Yeah.
contrast to hepatitis C, and that's the
Yes.
positive thing which we need to explain to the patient, that there is a chance that your body might clear it on its own. However, when we are explaining, for example, if the same scenario and we replace
So
Hep B with Hep C, the chances of self clearance are
yes,
very low. So you
very
can say
low. Yeah.
very, very unlikely that you are going to clear. In that case, you will go that chronic route. You will tell that you need to have these medication and all these things. For Hep B, the chances of self clearance they are very, very high.
Yes, you're right. Okay. Thank you for discussing this point. Yes, it's according to the scenario, but you don't know what the status here. Is it something to be clear? So I cannot also say you will be, maybe they will consider it as false hope, right? You are giving false hope. That's why be neutral in your talk. If he asks about, is it something to be cured, you can say, I will update you after discussing this with the liver doctor, because you don't know about the details of the scenario. Okay, knowledge wise, yes, you're right, but in the scenario, you don't know. If they didn't mention, we cannot say it. They might consider it as I said, false hope. Okay, thank you, Dr. Hacham. Let's start second scenario. Anyone has question, we can discuss after this. Okay, Dr. Khalid, ready?
Yes.
Okay, here you go.
Hello, I'm Dr. Sanhuri. I'm one of the doctors in the clinic today. Am I talking to Miss Kathleen, 30 years old?
Yes, Doctor, I am Miss Kathleen.
Miss Kathleen, we are here to discuss some issue related to your health condition and addressing your concern. Is that okay with you?
Yes, Doctor, yes, I am ready.
Before we proceed further in our discussion, Miss Kathleen, may I know to which extent you know about your condition?
Yes, Doctor, I have this problem in my gland in front of my neck since a long time. They tried with me this medication, some tablet, because I have, they told me some activity in the gland for my heart racing, sweating, my blurring vision. But they tried again to remove it from to to titrate down my medication, but they told me last time again the gland more active and told me there is something they will do for me. I am coming to know.
Thank you, Miss Kathleen. Appreciate your knowledge about your condition. Yes, Miss Kathleen, being have this long story of hyperactive gland and you take medication for a long time. So now our consultant decide to give you a treatment, what we call it, radioiodine. Have you ever heard about it?
No, no, doctor. This first time to know. It's something serious.
Okay, I will explain for you, Miss Kathleen. This is a type of treatment of hyperactive gland given for people usually who using medication for a long time and not control his symptoms. It is some sort of capsules. You will take it orally, and this capsule will travel to your gland in front of your neck and destroy it.
Destroy it. So my
Yes.
gland will be finished.
Okay. So thank you for this question. Yes, because this gland is hyper functioning, there is this type of capsule. When it reaches the gland, it will work to decrease the size of the gland. So it is mostly it will destroy this hyperfunctioning gland. So that excess hormone causing the symptom for you, it will become less, and hence the symptoms that you have, like a shaking of the hand and sweating, will come down and will disappear. Does that make sense for you, Miss Kathleen?
Yes, doctor. If it is like this, it will be okay. I need to be free from these symptoms because it is intractable my life really.
Yes, Doctor. Yes, Miss Kathleen, and our consultant make this decision in the best of interest of your condition.
Okay, doctor. I will be admitted to the hospital.
Uh, I highly appreciate your question, Miss Kathleen. Actually, this is just a capsule we can give you and let you to go to the home, but we need to from you to take some precaution after you taking this capsule.
Yes, doctor. What precaution, please?
Precaution, for example, because this is contain what we call it radioactive active material. So if, for example, try to be away from the pregnant lady and especially young children, uh, but generally we advise you to be away from person. But before that, we will be sure that you are not currently pregnant or you are lactating. Have you ever have this?
No, doctor. Nowadays, no. But I am not sure. I plan to be pregnant in the next year. But I have children. I have 3 years and 5 year children. It will be harm. It will harm them.
And no so much problem, Miss Kathleen. We need to be away from them just a short period, matter of few days.
Okay, doctor. What about my activities and my work? I will go or what? I will do this for this.
Okay. Just in the first few days, we need from you as much as you can to be away from the person. The person generally, and especially the pregnant woman and young children, just a matter of few days.
Okay, doctor. Will give me some report to my job to give me some sick leave until we finish this duration, this time.
Definitely, Miss Kathleen, yes. And what job you are doing?
I am secretary.
Okay, because we need from you to be away from the person in these few days, we will give you report for your job.
Okay, okay, miss. Okay, doctor.
Miss Kathleen, yes, this is an effective treatment for your condition, but on the long term, your gland may be hypoactive. That maybe at some point of time, we need to give you, we replace you by the hormone of this gland. So the condition will be reversed.
What is this, doctor? يعني my gland will be damaged, right?
Yes, in the many cases of who receive such treatment after a long time, because this capsule will give you will destroy the gland. So now you have hyperactive gland. By the time there is strong possibility you may become hypoactive gland, and we need to replace for you the hormone of this gland, what we call it thyroxine.
Okay. So this medication, doctor, will be for life or for a temporary time?
You mean radioactive iodine or replacement
Yes.
of the hormone?
About this medication, I will take only one time radiotherapy, then my gland will be out of order, then I will take this medication for life, or what is the plan?
Yes, this medication, what we call it radioactive iodine, decided by our consultant. Yes, it's a single dose. But I told you about the long-term side effect of this medication. Your gland may turn it to be hypoactive. Then we will need to replace you with the hormone. Most likely will be for life.
Okay, doctor. Okay, understood now.
Yeah. Do you have any other concern, Miss Kathleen?
No, doctor. No, it is clear now. I will take this session. I will not be admitted to the hospital. Then I will follow to see if
Two
my
minutes
gland
left.
again, if my gland, if I feel what I will feel, doctor, if my gland become like this. How I know that it become not active?
Yes, this is good question from you, Miss Kathleen. Uh, in such a condition, you may feel difficult to tolerate cold weather, and sometimes you may start to gain weight, and sometimes your skin may be little dry, and sometimes you may suffer hard stool, and your period may be little heavy.
Okay, okay, doctor. Once I feel this, I will come again to the hospital to give me the medication. Okay.
Miss Kathleen, do you smoke?
No,
Do you drink alcohol?
socially only.
Okay. Miss Kathleen, may I know what you get from our conversation today?
Yes, doctor. I know that this medication for my hyperactive gland not effective. That's why you decided to give me that radiotherapy for my gland, and hopefully it will control my symptoms, and I will be away from persons for few days until this substance free from my body. Then I will follow the clinic, and if I feel that I have some cold intolerance or some my period problem, I will come back to the clinic to check
Uh,
the.
Thank you. I will give you some website and brochure to read more about this radioactive iodine and why and how they use it for hypoactive gland. Is that okay?
Okay, doctor. Thank you. Thank you.
Thank you, Miss Kathleen.
Okay, the time is up. Thank you, Dr. Khalid. You can comment now, Dr. Muhammad.
Yes, Dr. Khalid, mashallah, يعني he covered most of the points, but he missed two things important, or maybe related to one thing important. Two things important. Yes, explained the procedure during what they will do, and the very simple. The after, the precautions after, yes, isolation, maybe 7 days, no problem, few days. She told you, I am not sure about the pregnancy, so we'll do for you, sorry, we'll do for you pregnancy test, very important for this. Uh, And the before the procedure, very important to tell her we need to be sure that no that carbimazole tablet that you're taking should be stopped at least 2 weeks, and we'll check again your gland activity to be normal before going to this procedure. And very important about any other medication should be reviewed by the team, and to avoid any seafood or iodine containing foods also is very important. So the precaution before you mentioned only pregnancy, about the diet, about the other medication, about stopping any medication treating for the gland until we 2 weeks to check again, because it affects the treatment itself. It will make the radiotherapy not effective. The very important thing also before, so pregnancy test, diet, any other medication, checking your gland activity after 2 weeks from stopping the medication. And they put some trick here, the blurred of vision. يعني the case, this case, and they put mark, big mark on the blurred of vision. She mentioned blurred of vision. You didn't stop her from driving. You didn't tell that you will review your vision and the eye and the ophthalmology doctor to confirm it's not affected by gland, because this may affect the decision of giving radiotherapy. This is the procedure. Second, you told one information, no need if you are not sure. The radiotherapy not one session. It may be 2, 3 sessions. Maybe the first one be filled. So if you are not sure of the information, better I will update you by the radio team about how much, and they will follow you closely, and they will decide how many sessions to be given. That's all about yes. If also last advice for her, she mentioned I plan for pregnancy next year. So you will tell her your pregnancy must be planned with the OB/GYN doctor, and at least it will be 6 months away from the session. So also this important information. Last thing, خلاص she feel that she is okay, she will go on. You should offer her the consent. We'll give you consent to read about it and take your decision. And anytime you can stop it, we will not do anything without your approval. That's all my comment. But يعني generally ما شاء الله done. Only the some precaution the procedure. Okay.
Yes, thank you, Dr. Muhammad. So the skills was fulfilled apart from the clinical communication or welfare might be affected due to the driving, right?
Yeah.
The point of driving. Okay, so as Dr. Muhammad said, to notify whenever you have vision issue in the scenario, please remember the driving. And the other advice, whenever you have female in the childbearing age, not only hyperthyroidism or radioactive iodine, any scenario in the female in the childbearing age, ask about pregnancy or birth control pills. So either this or that. It's a rule. Put it in your mind. Whenever you have female, first of all, I have to remember the age. If the age in the childbearing age, I have to ask about these things. The other thing, the driving, whenever there is eye or vision issue, not only in the state or in the scenario, in the disease itself, it might be. For example, if they mention to you multiple sclerosis patient, sit with him, counsel, or talk about the possible plan and so on. Once you remember what's your job, ask, or do you smoke? Do you drink alcohol? Ask, do you drive? It's very important. Why? Because multiple sclerosis usually or some of the patient will have vision issue, double vision or whatever, optic neuritis. So anything can affect the vision. Remember to address it in any scenario in the communication. The other point I want to mention here, the consent form, it's very important. Dr. Khalid missed. Apart from that, the scenario went well. It was good and as general. So they can minus you only in the welfare Clinical communication, maybe they will minus a point of consent. Okay, any medication or any procedure will be offered to a patient. Remember to ask at least to ask about verbal agreement. Instead, Dr. Khalid, and if, instead of asking what you get from our meeting today, you can ask about the concern. I don't know if you ask any concern there, and you can offer the consent form, and also regarding the closure of the scenario. What's your opinion about this procedure today? Are you agreed to do this procedure? Okay, if there is consent, it's enough, formal one, or written consent, I mean. Or if no consent, at least offer the verbal consent. So you can ask, what do you think? Are you agree? Can I know your opinion about our medication today? Just to show the examiner that you got the acceptance from the patient. It's not the time to order it. It's a conversation scenario. So you are giving the risk and benefit, and you are asking for the agreement from the patient. Okay. Yes, the avoidance of pregnancy, avoid of the babies or kids, very important, and the vision as well. Graves or vision issue in the graves, it's contraindication to have the radioactive iodine, right? Smoking is
Yes.
very important. I think you addressed the alcohol as well. Yeah, so you know how to do it. Just try to manipulate the tone, be more sympathetic, empathetic, in order to be more professional. Thank you, Dr. Khalid and Dr. Muhammad. Now we can. You have any
Point,
question, Dr. Khalid? Yeah, yeah, sure.
thank you. And I told him when he asked me, I will take this capsule and went to home. And I told him, yes, I am not sure about this point. Is that like this? Patient will no need for observation for few hours or
Yeah,
Yeah,
as
only 2 hours, 3 hours maximum. Only 2 hours.
yes, as a golden advice, anything you don't know. We are not here to know everything. Okay, even you are medical doctor. Sometimes you are not exposed to this experience before. In order to avoid the mistake, don't do or don't say something you don't know. Okay, once you don't know, refer to the assigned team, or I will update you in the next meeting about this question particularly. If you know the information, say it safely. If you are not sure, don't say something you don't know, might harm your mark. You might say something will be very wrong, and the examiner will be angry. Maybe he will fail in the whole station because of one mistake. If you said something like fatty, something you said it away from the nature or away from the reality. So avoid this. If you don't know, it's not an issue to say I don't know. The problem if you say something which is very wrong, if you are not sure. Okay.
okay.
By the way, not all of us know about this radioactive iodine. Most of these, and I think in the IV room or like in the procedure room or the endocrinologist, and you are here the exam of IM. So if you know it, and not all of us know it, okay, you can mention. But if you don't know, don't say. We know all of us that the contraindication of radioactive iodine, three things: the eye disease, the kids, the pregnancy, right? And as Dr. Muhammad said, you can avoid the food, seafood. This is one of the instruction you can add. The observation, or I don't think it's long observation. The pregnancies should be avoided. So these are the things you can talk and you can use it as a weapon to build your scenario on and the discussion. In details, if anyone ask or any surrogate ask in more details, if you know, answer it. If you don't know, you can say, I will update you in another meeting. Usually it will be two question or one question you are not sure about it. Because at least you know most of this information. But if you don't know, as I said, don't do it. Clear?
Okay.
Okay. Anything else you want to add or to ask?
For me, thank you.
Okay, thank you, Dr. Khalid. Dr. Muhammad, you want to add anything to ask?
no, Dr. Basim, thank you.
Okay. Anyone want to comment or to question? Yes, Dr. Ashayma, can you please repeat the explanation of procedure? You mean the steps of every procedure during and before and after, before and during and after, or what procedure? The radioactive iodine, it's capsule. The patient is swallowing and they can stay for a while or couple of minutes, sorry, couple of hours, and later on they can go home. It's not major procedure. It's just something to be swallowed. Okay?
Thank you.
Okay, thank you, Dr. Shane. Okay, this only. Okay, Dr. Salma, what about new medication for hepatitis B? Tenofovir, you mean? First care. It was tenofovir. What medication?
I need to mention in the scenario or
No.
or-
Don't say something not mentioned. If the surrogate asks you, you can mention according to your scenario as well. If mentioned there, antiviral can be offered, you can mention. The medication offered written there, tenofovir, you can say, yes, there's medication called tenofovir. What are the side effects, doctor? There is a lot. As every medication and every procedure, this is a general answer for any procedure and any medication. As usual, any medication has the risk and benefit. Usually, we are weighing the benefit and risk. Once the benefit outweigh the risk, we start this medicine. For you, the benefit will be 1, 2, 3, and the disadvantage or the drawbacks or the bad effects 1, 2, 3, according to the medication. If you know, you can say. If you don't know more details, just say, as any medication, reaction can happen because you start new medication. You can have some GI upset. Don't be more specific unless you know a specific complication for this medication. Okay?
Okay, thank you.
Otherwise, try to be more general in your talk. Sometimes they can bring like steroid. Don't tell me you don't know what are the side effects steroid. Something you have to know, you have to memorize them from A to Z, from the head till the toe. Every complication you can mention in the steroid scenario. But if something like tenofovir, something is not usually and not popular using, you can just mention some of the general side effects. If you read about it before the exam and you know about them, you can enumerate. If you don't know, don't mention something you don't know.
Okay, thank
Most welcome. Again, it's a time and it's a scenario, and if it's a task and station, I mean the communication, to test you how to communicate rather than judging on your knowledge. Yes, there is some judgment on the knowledge, but not at the communication skill. Okay? They sometimes they judge on your knowledge. When they are judging on their knowledge, when you mention something wrong, they can minus you. If you mention something correct, they can give you good mark. Otherwise, it's not the matter to how to manage, how to give the medication, but you have to know some of the information and to deliver it in good way to the patient. And to leave this station, the patient knows most of the information about the procedure or about the medication or about the disease. This is the way how to do the communication skills. It's nightmares for some doctors, but if you practice it in this way, you will love it. You will love it. You will like and you will love it. Okay? Any question else?
دكتور لو سمحت أنا يعني
Yes.
مش عارف السورس اللي بتحضره من الخالات بس عشان ممكن أشارك يعني ولا
Okay, Dr. Hasni, message me directly, the WhatsApp. I will send you some books, rider basis, cases for basis, basis for or cases for basis. Some
عندي
books.
عندي
Yeah.
كتير.
Okay, these are the books you can do from them. You can do practice from. You can read the case, how you can do as a surrogate, and what about the candidate, what you should know. If you prepare a case, you can present it. But please, before doing this, you have to listen more in our session. You can listen also to the recorded sessions. And it's simple, okay? Just message me directly. I will give you more information about that.
أوكي شكرا دكتور ألف شكر.
Okay, most welcome, Dr. Anyone else want to ask?
Yes, I mean,
Yes.
yeah,
Okay,
Dr.
doctor.
Basim, I think my connection was lost, so I wasn't able to listen
Okay.
initially to the discussion. But I think that, yeah,
Mhm.
I think that most of the things have been covered. So because I haven't heard, so maybe these are things which have already been covered. So I'm just maybe kind of a recap. So basically, the patient may ask in this scenario about that why, because a lot of time in the scenario or when you're discussing with the surrogate, he'll say that I'm doing okay with the carbimazole or with medication. So why you think it is important that I go for another treatment if I'm doing okay with that? So you just need to tell the patient or the surrogate the rationale that why. And apart from the other thing, I think that one justification for this treatment, which we need to tell to the patient, is that because carbimazole is a medication, so it is a kind of a medicine with relatively long-term effects. Because I have come across such scenario before, and patient initially was of the, I mean, he was thinking that maybe if I will be given radioactive iodine, I will not be having any treatment. So when I told her that okay, you will have this, and after that, we'll monitor your blood thyroid hormone levels, and after that, once it's completely suppressed, then we'll start you on thyroxine replacement. And then she said, "So what is the point in doing a radioactive iodine when you are again going to put me? So it is not going to get me off medication. So you need to tell some of the significant side effects of the medication, like what could happen if you have been on long-term carbimazole, that it could increase potentially your risk of infection. And regarding thyroxine, you need to tell that it is a normal or natural hormone in the body. So if although we are giving you a medication even after this radioactive iodine, but it will just be a normal hormone which your body normally produce, but in your case, it will not be producing that. So generally, if we achieve a steady state with the medication, so it is not going to cause any side effect in that regard. So I think that's something which we need to explain, because a lot of time, and I said that this happened because I practiced this scenario, that the patient was expecting that most likely after the procedure she will be off any medication. So you need to tell that thing to the patient, that we are just doing this because the current medication, it is something which we generally don't prefer on a long term basis. There are significant side effects because of the neutropenia and all these things, and that can cause a potentially life threatening infection. So you need to tell that to the patient. I think that I have, because initially I listened, I think that Dr. Khalid explained the procedure. I think it's everything was, explained in a proper way, that how it has been done. And either you give a capsule to the patient or you give some liquid. So it depends that which center is using capsule. So it is something, so either a capsule or a liquid which the patient need to drink, and the patient can go on the same day, about 2 to 3 hours after the procedure, the patient can go home. And you need to tell the patient what to expect after that. I think that he touched the consent part as well, because consent will be important as well in this case. And then do tell that what could he expect after that radioactive iodine therapy. So there could be some neck tightness, neck pain. There could be some nausea, maybe even some kind of feeling of throwing up. So these are the common side effect of that. And then most importantly, what to do, or what the way forward in the next few days or a week. So normally the isolation period, it depends upon the dose of the radioactive iodine we generally give. So it can range anywhere between 3 days to a week. Most of the time, the dose is higher when you are treating someone with a cancer. And if you are treating someone for just a grave disease, so dose may not be that higher. So it all depends. Obviously, I'm not going into all these technicalities, but you can tell the patient that you need to be kind of in isolation for anywhere between 3 to 7 days, depending upon the duration, the dosage of the radioactive iodine. And then other thing, I think they already been covered, that if there's anyone who is pregnant in the same house, the patient should not be in touch with that patient, because pregnant lady in that vicinity could have been affected by these radioactive rays. The other thing, should not be in touch with any children living in the same house. And Yeah, so these are the two things which must be avoided. You mentioned about pregnancy. I think that's pretty
Yeah.
valid. Obviously, that you need to avoid becoming pregnant for about 6 months at least. And then the other thing is that, I mean, you need to ask about the patient at the time of the procedure as well, if the patient, because it is something before that you need to have a negative pregnancy test as well. And also ask the patient whether patient has been currently breastfeeding or not, because if someone is breastfeeding, in that case you need to stop breastfeeding for a couple of months before undergoing a radioactive procedure. So these are the things I think they are important. Then when the patient is at home, ideally should, I mean, use her own utensils, should be in a separate room with all the bedding and linens separately change, and also have a separate toilet and all these things. So I mean, it's a kind of an isolation, because whenever, so any secretions coming from the patient, it will contain radiation, and this radiation, as I said, that depending upon the dose can be anywhere from 3 to 7 days. So you just need to explain that thing and the rationale that why you are going to do it. Is not because a lot of time people do get anxious that may I be infectious, that why you are isolating me. So you need to tell that this is the reason, that there will be some radiation coming through your body and the people around you, they might be affected. So you need to just tell. So I think that's, I just recap that. I think that most likely it has been covered, because, but I didn't, I was disconnected. So I just wanted to recap that. Thank you.
Yeah. Okay, thank you. Troponin. Thank you, Dr. Hisham, for reminding about this point. It's very important. And I want to add one more point as a golden advice. Whenever you are saying or advising regarding the task, say in the best interest of your condition, the consultant advised to start this. So it will close all the doors. Why you started me on this? Why you stopped that? In the best interest of your condition. Sometimes, if you don't say that, the surrogate will argue with you. Why, doctor? Tell me. I want to know. And it will take time from other tasks. Yeah, you can say because of side effect of other medication, but also you can say in the best interest of your condition, the consultant advised to do so. The other thing, don't forget, if the patient asks you in the future if no more response to the medication, what you will do, and you can also add to them whenever you have difficulty of breathing, difficulty of swallowing. I'm talking about compression symptoms. Please let us know. Maybe the surgery can help you in this condition. This as a complementary comment regarding this topic, but it's not the task. Just to be more aware about the all possible management plan for any goiter or hyperthyroidism, the medication, I mean the pharmacological option, the radioactive, and the surgery. Always put them in your map. Okay. Thank you, Dr. Hacham again. Dr. Muhammad and Dr. Khalid. Anyone has other question before ending the session?
Nothing.
Yes. Huh?
Now one point hit my mind
Yeah. Sure.
regarding
Sure.
consent. Usually we
Yeah.
send verbal, written.
Yes. As something radiation or chemotherapy or biological therapy, something which is not usually given to the patient. You can give the patient as single dose, or medication would be given focused with monitoring and observation, concentrated medication. Those medication sometimes, usually they need written consent. Clear? Written consent. So as I mentioned, for the written consent, the procedure, or something like for radiation or with radiation, like radioactive iodine, chemotherapy. Chemotherapy need biological therapy need also, because there is reaction might happen. Some medication for multiple sclerosis, which can do immune modulator. Okay, the abnormal medication that we are giving as once or every 6 months, you have to take written consent. Otherwise, other medication you can just have verbal consent. Clear?
Very
What if you
clear.
are not sure? Yeah, if you are not sure, Dr. Khan, what if you are not sure? At least have a verbal consent. Like, What's your opinion now? Are you agree to take this? Yes, doctor. At least you show the examiner that you got his agreement, because you are not giving the medication to any patient by force. We are here to share the decision. I am saying to you the option, then you are the one deciding if you agree or not. You got it? So
Uh,
at least do the verbal. If not, something very important to have written consent in the procedure, or the medication I prescribe already. Yes, what else you want to ask?
what we call it, but I forget the English term, what we call it.
Ah,
يعني ضمني، يعني consent، موافقة ضمنية، صح؟ هل
yeah,
can we apply
yes.
فيها؟ Well, I don't know in English what I forget the term. يعني
It's
موافقة.
okay. The written one include the verbal. Okay, but the verbal one doesn't mean that you got the written one. So the written one will be the one. Uh, uh, I mean, what you want to say in Arabic. So
want
it's
to say مثلا
the
this patient
formal one.
agree not formal يعني موافقة ضمنية، يعني when I ask the doctor to recap to
Yeah, but he might say at the end, doctor, but I am not sure I can take this medication. I am hesitant to take. Yes, he recap, but he didn't give you the last decision that I agree, doctor. He might say it in between, but he might also say, but still, doctor, I am not sure. I can think about it. So the most clear one to ask, what do you think? Are you agree to take? If he said yes, you succeed the scenario. If he said I will think, okay, tell him think. This is your right to think about it. But at least to show the examiner that you are getting the approval or the acceptance or the agreement. It's a matter of I give you the decision, my decision, and you have to sign or to say yes, I agree. Before entering the hospital, any patient at the emergency, he's for admission. What they are signing admission consent, including the medication, the investigation, the lab, everything, right? So even the admission itself, you get the consent. For the medication, specific medication, you have to take specific consent. Or if you want to counsel about medication, you have to sit with the patient and to talk about it. And if he's agree, you can get either verbal, if the medication something to be given specifically, or the usual medication like antibiotics included in the admission consent. You got it?
thank you Dr. Basil,
Yeah,
valuable
Dr.
comment.
Hisham. Yeah, Dr. Hisham mentioned to you informed consent and written consent. This is what you want to say? Informed consent and written consent. So informed means you said and you got, but without written one. The written one, of course, including the informed one. Okay. Yes, agree now with this point, Dr. Khalid.
Yes, very clear, doctor.
Oh, okay. Okay. Anyone
Yes,
has
and
questions?
yes, I think
Yeah.
that Dr. Khalid, I think here it will be a written consent because of the impact of the treatment which you are going
Yes.
to give.
Exactly.
Because if, for example, if the patient says it's okay and then she become pregnant, say after
Something
1 month,
happened. Yeah.
okay, so
She
then
will
you will be in
complain.
trouble. So here, because
Mm.
in radioactive iodine, you need to have an informed consent. Oh, sorry, a written consent, not
Written
informed.
consent.
Yeah.
Yes, yes. Written consent. Sorry, informed consent for the usual medication, antibiotics, the PPI medication for antiplatelet, antischemic, all this as informed one. But for the specific, as I mentioned, you have to take written consent. Okay. Thank you, Dr. Khalid, Dr. Muhammad, Dr. Hacham, and everyone in this session. See you tomorrow, inshallah, with the long clinical consultation day. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum assalam wa rahmatullah.